below the surface. If they don't have any stool for 24 hours, that's another reason to investigate. Just because you can pass a thermometer doesn't mean that you have an intact system, intact GI system. If you can pass a thermometer, you have at least an intact anus, but it doesn't mean it's connected to the colon above it. So you need to pass stool and be able to pass a thermometer. You can have an imperforate anus if you can't get a thermometer in to evaluate the temperature. We don't just keep pushing past it. They have an imperforate anus, you stop and you take the temperature axillary and make a note. This is a picture of an imperforate anus. It looks like there's a hole there, but it's really a covering over the top of it, and we don't want to affect the integrity of that. If they have diarrhea, that's not normal for a newborn baby. That's something that needs to be investigated. If they have bloody stools. So bloody urine or bloody stools, neither one of those is normal. Neuromuscularly, we do a bunch of different neuromuscular evaluations to make sure that the baby's meeting what they should as a full-term baby. Rooting reflex they should have. You touch the cheek, the baby turns toward that stimulus. That's one of those things you want to teach the parents when they're breastfeeding. Don't touch that cute cheek that's up on the top because that baby will unlatch and turn toward the stimulus. Sucking. All babies have sucking reflex. They'll suck on anything that comes close to them, fingers, nose, whatever. Moro reflex is the startle reflex. All you got to do is bump the bed or bump the baby or talk loud or drop a spoon in the room and they'll startle. Crawl reflex, you put them on their belly and they'll do a little crawl for you. Step dance, if you hold them upright, put some weight on their feet, they'll do what looks like a newborn step or dance. Gag reflex, I think everybody's seen a baby do a gag reflex. That should be intact. And a grasp reflex. They have not only a hand grasp, but they also have a foot grasp reflex. And Babinski, where you stroke their foot and their toes flare out. That's normal for a baby. It's not normal for an adult to have a positive Babinski, but it's normal for a baby to have a positive Babinski. Select all that apply. A nurse performs an assessment on a newborn, 39 weeks gestation with APGARs 8 and 9, which are not normal findings in a newborn of this gestational age. A slight heart murmur heard at 6 hours of age, overlapping skull bones, bluish hue of the fingers and toes, slightly incurving pinna, expiratory grunting with respirations. So, we hear on a full-term baby who has APGARs of 8 and 9, he started out good. A slight heart murmur at 6 hours of age is too long, so that would be not normal. Overlapping skull bones is normal. Bluish hue of the fingers and toes is normal. Slightly incurving pinna. Slightly incurving pinna means the top of the ears is curved over. That's actually a good thing. Expiratory grunting with respirations is not a normal finding either. If they're grunting with respirations, that's a reason to do further investigation.